is a need for reform in health care. We all know that.
Whether you're insured or not insured, you're a victim to some extent of rapidly rising healthcare costs.
Year after year, for the last 3 to 4 years, healthcare costs have risen double-digit with no end in sight.
This issue is like a three-layer cake. There's the health status of the population, which isn't good enough. There's cost and quality, which affects 100% of people. And then there is the issue of access to insurance.
Businesses and individuals in Connecticut have been struggling to cope with a healthcare system that continues to be more and more costly. And as costs rise, so does the number of uninsured as more and more people opt out of the system. Policymakers are pushing to reform healthcare in Connecticut. But the question is, how?
I think there are two fundamental choices that policymakers have in Connecticut. One is to work off the strengths of our current system and make some changes to it so that we can maintain a system which is based on employer-sponsored health insurance as well as public sector assistance in those areas where people don't have an attachment to the workforce. And then second choice is for the state government to take over the administration of health care for everybody in the state of Connecticut. Obviously, we believe that doing some common sense things to reform our current system makes a great deal of sense.
And the right way is absolutely preserving our employer-sponsored insurance system. Two-thirds of the people in this state currently have that system.
And the surveys show that they like it. So why would you want to rip that up and start with something that would be disruptive for two-thirds of the population?
Keeping our current system of employer-sponsored health insurance is preferable to a government-run approach. But certain improvements need to be made to that system.
Fundamentally, I believe that with the appropriate reforms and national agenda, the employer-based system, combined with government subsidies where needed and the private market, is the best way to respond to this crisis.
The current system is already providing a great deal of benefit support for the people in the state of Connecticut. But what we need to do to make sure that we can strengthen it is really three things. One is to try and address some lifestyle issues so that we can avoid some preventable diseases, which obviously drive up the cost of health care coverage. The second is to really look at both cost and quality of health care so that we improve the value statement for the dollars that are being spent in health care. And then the third is to make sure that we can cover that 9% of the population which is currently not insured. We need to avoid medical errors. We need to make sure that we're avoiding doing testing that is not necessary. And quite frankly, we need to make sure that we are doing everything to have the best outcomes, medical outcomes, that are possible.
There are critical improvements that hospitals need to make. They need to invest in infrastructure. They need to invest in technology and in people to improve quality and patient safety.
And we need to focus on how we can use technology to work together to ensure that people get the best possible care.
The question for policymakers is, who's better equipped to make these improvements, the public sector or the private sector?
The track record from the private sector far outpaces the public sector when it comes to innovative programs to drive the quality and reduce the cost of health care.
Government-run systems around the world show that their costs are not going up any slower than ours, and they have, as we know, acute problems in terms of access to care and innovation and quality.
You've got people that are going outside of those countries to places like India to get services when they can't get them done. And there isn't the level of innovation that you see in healthcare that you see here necessarily in the United States.
We value in our country access, choice, customer service. What you get in countries like Canada or New Zealand or Great Britain is altogether different. It's rationing, it's interminable waits, and it's really the denial of care. And frankly, we would never tolerate that in this country, nor should we.
Some legislators and interest groups are calling for Connecticut state government to take over all administration of the system. But the state hasn't done a particularly good job in managing its own role in health care.
You'd like to see a good track record. You'd like to prove that they have the ability to provide quality health care insurance to the people of the state of Connecticut before you gave them that responsibility.
One area where the state falls short is Medicaid funding.
Private employers are very concerned about the cost of health care, and a huge percentage of the increase in the cost of health care is the need for hospitals to cost shift. Currently, the state is underfunding Medicaid to hospitals about $300 million a year, so that is passed on to employers, which means their premiums are approximately 15% higher than the cost of actually providing the care.
When combined with payment shifts for uninsured patients, employers' hospital bills are increased by over $400 million annually. This is in addition to any cost shifts for federal government underfunding of Medicare. And underfunding also affects patients' ability to receive adequate care.
I work with doctors, and our doctors see Medicaid patients, but they can't find specialists to refer Medicaid eligibles to, because the reimbursements are so low that many doctors simply won't take any new Medicaid eligible people.
Another area of concern is the state's own skyrocketing health care costs, caused by a very rich benefit package for state employees. And the state has had great difficulty in managing its employees and retirees' health care in a cost-effective manner, as evidenced by a $21.7 billion unfunded liability for health care.
When you look at the state of Connecticut's own employee workforce, Connecticut locked itself into a long-term contract, which is very expensive and unaffordable in the private sector. If we were to duplicate that for everybody, taxes would have to go up dramatically. If you look at that same employment base, Connecticut has failed to adequately reserve for the promised retiree health care benefits of the people that it's currently serving. There are billions of dollars in unfunded liabilities.
Considering how it has managed its own health care responsibilities, a state-run health care system would be a hugely expensive proposition, with estimated costs topping $17 billion a year.
I'm very concerned about the solution of a single-payer system in which the state of Connecticut would cover the costs to our residents for health care for residents under 65. Preliminary estimates that I've seen are $17 billion, which almost equates to the entire state budget. This would mean to me that we would have to increase taxes, and the state of Connecticut already has one of the highest tax rates in the United States, and I'm very concerned that this would make our state economy even less competitive than it is today.
One of the other ideas floated at the state capitol involves pooling by expanding the state's municipal employees' health insurance program.
You have to smile at that. I mean, some of our biggest employer pools in the country have highest health care costs. Look at the automobile companies and their fabled huge health care costs. Pooling is useful in terms of lowering administrative costs, but that's only a small percentage of the dollars. 85% of the dollars are in healthcare delivery, not in the administrative layer.
The reality of the situation is that about 14 cents of every dollar in premium cost goes towards administration. Of that, about 6 cents goes towards regulatory costs and taxes. Another 5 cents or so go towards the administration of customer service and those quality initiatives that we've been talking about. So those kinds of costs have to be continued to be absorbed.
Everyone has a stake in the outcome of the health care reform debate. Regardless of who pays, we must continue to encourage people to take more responsibility for their health and lead healthier lifestyles. And we must improve the overall quality of the system, reduce its costs, and make health insurance affordable for more people. Business people must be engaged in the debate and urge policymakers to keep Connecticut's economic health in mind, as well as the health of state residents.
I think that working with the system we have and reforming it is a better approach than just throwing it out altogether.
If we were to go to some sort of government-based system and health plans were reduced to some rather insignificant role in that system, that could prove devastating to our Connecticut economy.
We have a problem today. It's going to be a crisis tomorrow as we continue to face changes in our population and the chronic underfunding continues. So we all need to work together. This has to be our priority, and it has to be addressed by our state.
As we move forward in this process, we need to strike a balance between providing health insurance for all residents of Connecticut with keeping a vibrant, competitive economy.